Good morning. How are you doing today?
Oh yeah, I'm doing good. Hey.
Hey. Mr. John. Here, let me help you.
Okay.
I see you have a prescription here.
Hey. Why didn't they let me bring my dog in?
I'm sorry. This is a store policy. Would you mind? I help you to sit down. Yeah, just go ahead. Sit down.
Oh, okay.
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 How are you doing today, sir?
I've been better. My doctor gave me that. I went to the hospital.
Okay.
I can't. I just want to get my prescription filled and go home.
I see.
It's been a bad day.
I understand it. Let me process your prescription so we can get you out of here as soon as possible.
How long is it going to take?
Not that long. Just give me a few minutes and I process your prescription, okay? Mr. Sereno, if you wouldn't mind, I have to actually get in touch with your physician because I need to verify something pretty quick, okay?
Don't you need some of my info?
Yeah, I mean, I see you have your name and everything here.
Okay.
Your date of birth is 5/24/1981.
Yep.
And your name is Mr. John Sereno?
Yeah, it's Johnny.
Johnny?
Okay.
So I can call
Johnny.
you? Okay. Mr. Johnny, are you still at 32 Meter Street?
Yeah.
Okay. Good morning. Yeah, my name is Daniel Nejadi. I'm a pharmacist at MCP. I'm calling regarding Mr. John Sereno. Date of birth is 5/24/1981. I'm trying to get in touch with Dr. Donald Simar. Good morning. Is it Dr. Simar?
Hi, Daniel.
Yeah, how are you doing today?
I'm doing all right. What can I do for you?
I'm actually calling regarding the prescription that you issued for Mr. John Sereno. By the way, my name is Nejadi. I'm calling from the MCP. I'm a pharmacist.
Okay.
The order that you have it is for Alvitron, and you just said 1 PRN. I'm not sure whether you are trying to order a rescue inhaler or you are ordering the nebulizer.
God. Okay. The nurse should have taken care of that.
Yeah, I see, but there's the only thing that I see on your script is Alvitron 1 PRN.
Okay. Hold on 1 second.
Sure. Thank you.
All right, Daniel?
Yep.
Okay, so what we're going to do is albuterol nebulizer every 4 to 6 hours PRN.
Okay. Let me repeat it again if you wouldn't mind. The order is for Mr. John Sereno. Date of birth is 5/24/1981. And you give me the order for Alvitron nebulizer, one nebulizer every 4 to 6 hours as needed. And your name is Dr. Donald Simar?
Yes.
Okay, thank you so much.
Okay.
Hey,
Okay,
I'm not feeling so good. Okay, so
yeah.
can we
Yeah.
move along?
Yeah, sure. Mr. Sereno, do you have a nebulizer machine at home?
No.
Okay. And
He just told me there'd be some waiting at the pharmacy
and I see
for me to pick up with the medicine.
Yeah, and I noticed that, he just gave me the order for the nebulizer solution, but I noticed that you don't have any insurance. Do you want to purchase the nebulizer?
I just need to buy it.
Yeah, sure.
I guess because I'm not doing so well.
I understand. So let me actually process the nebulizer solution that I have. The prescription that I just got it, and then and then we go from there. Okay?
Yeah. Why couldn't I bring my dog in here?
This is a store policy. They don't want anybody bringing their dog here. I know. In your case.
Okay, that's fine. Just fill it.
Yeah.
Just fill it.
Okay. Hold on 1 second. Let me grab the unit so I can show you how this works.
Okay.
Mr. Sereno, would you mind if you come here for a second?
Yeah.
Okay.
Do you want me to sit down or do you?
Yeah, you can sit down. I'm just going to move your chair a little bit here. Okay. What I'm going to do right now, I'm just going to go ahead and show you all the parts of this unit, so you can actually, when you go home, you can actually use it by yourself, okay? So do you mind if I hold your hand while I'm showing you all the parts?
That's okay.
Okay, yeah. So this is actually the top. You're just going to open the top portion. And then here, if you notice here, you see here, this is where actually the tubing part is supposed to go.
Okay.
Okay, and then I move you here. This is where the filter goes. You can, yeah, exactly. You can remove it. And
So that's the filter.
exactly. And there is a button here. This is a turn on and turn off. Okay.
Yep.
So now the other pieces that I would like you to feel is going to be the tubing portion. This is the one of the tubing.
Yep.
Which
I feel it.
Yeah, exactly.
Okay.
And then let me have your other hand. So this piece is supposed to go here.
Okay.
And make sure you push it really
yep. I think I got it.
You got it?
Wow, that's hard.
I know.
But I got it.
Okay.
You just check to make sure.
Yeah, you did a pretty good job.
Okay.
So the other side is going to, the other side of the tube is going to go to the piece called medication cup.
Okay.
And if you like feel it at the bottom, this is where the tube is supposed to go.
Yeah.
So I want you to go ahead and also attach that.
Feel it.
Okay. Okay, Mr. John, this is the medication wire, the nebulizer wire that you're going to actually,
okay.
Can you feel this, the top portion?
Yeah.
This is the portion that you're going to twist it.
These little things that jut out?
Exactly.
Okay.
And then once you twist it, you're going to put the medication inside the cup. And I'm going to show you, I mean, the mouthpiece, the other piece that you need to know. Let me have this medication. Okay. This is going to be the mouthpiece. You see that? And this is what is going to actually go and sit on the top of the the medication cup.
Okay.
If you feel this portion here, it's going to be the mouthpiece that's going to be you're going to put it between your teeth while you're inhaling the medication. Okay. And I want you to go ahead and right now, and after you put a medication there, I want you're going to go ahead and tie this as you did. Okay. So next step is going to be you're going to put this inside your mouth, and yeah, exactly, and you're gonna make sure that you hold it tight, okay? And once you have that, you have to know that once you put that one in your mouth, you're just gonna go ahead and you turn the units on. But one thing that you need to know, yeah, exactly. One thing that you need to know about this is inhale 5 to 7 times while you have the mouthpiece between your teeth, and then you're gonna remove the mouthpiece. You're just gonna inhale in and out without them having the mouthpiece between between your teeth. And the other thing is, when you have the mouthpiece, make sure that you inhale slowly and deeply. Okay. And the other thing that I forgot to tell you is going to be where you put that units. Make sure you keep the units in the you place it in the stable and clean area while you are using the units. The process of the inhalation is usually like 10 to 15 minutes, and you can check it to see if whether there is any medication left in the medication cup. But just like tapping the side, you can just like feel it. Yeah.
Like this.
Yeah. And if you don't inhale like any medication, that's the point that you should notice that there is no medication left in the cup. Okay. And the other things that I would like to talk to you about using this machine is you have to make sure that you clean it properly. This is really important for all the patients to clean the unit properly. All the pieces that were supposed to be clean, except the tubing part, every day. I mean, after each use. So make sure you detach all the pieces, and you just rinse it with the hot water and detergent, and then just put it on the paper towel, let it air dry. Okay. And some of the pieces is supposed to be replaced after 3 to 6 months. The mouthpiece usually is good for 6 months to 1 year. But again, since you fill your prescription here, you can bring all the parts every time you come here, so I can check it to make sure that all the pieces are clean and you don't need to replace it. And also the filter that you touch it, also needs to be changed every 6 months. And
So this?
yeah, exactly. And if filter is damaged, yeah, and you need to maybe change it earlier. And also the detubing part, we usually recommend it to the patient to change it every 3 months. But again, every time you come here to fill a prescription, you can just bring everything so I can check it to make sure everything's okay. But before I let you go, I want to make sure that I explain everything for you. So would you mind to explain some of the important stuff that I mentioned about this unit?
Okay. So what I gather from this is that I'm going to take the machine. I have to make sure I clean it frequently.
Yeah.
I also have to make sure that I take this tubing and connect it here. I turn the on switch here, right?
Yeah.
Before I do that, after I've attached the tubing, I'm going to take this thing and screw.
Yeah, but before you do that, you make sure you have the medication in there, okay?
Yep. And then, like,
exactly. And how many times do you have to actually, like...
Oh, that's right. You did say 5 times.
Yeah, 5 to 7 times, and then you're going to remove the mouthpiece, and then you're just going to inhale a bit of the medication. And how about the cleaning?
Yep. Cleaning can be every day. And hot,
can each use
hot soapy water. Can I have my stepson do it?
Yeah, of course. I mean, if you want, you can bring him one day here. I can also show it to him how to use the unit, and so he can help you out with that.
You do that?
Yeah, of course. So, any other questions, Mr. Johnny?
Yeah, I just one quick question before I go, because I really need to get out of here.
Sure.
So I recently bought a cat for my stepson.
Yeah.
His name is Fluffy. Now, sorry.
So you are experiencing, what you're saying is you are experiencing this shortness of breath because of the cat. So yeah,
but I don't know. It's just I recently bought it, and all of a sudden it feels worse in here. The cat is also one of the reasons that you're experiencing the shortness of breath. And what I'm recommending is make sure you don't let the cat to enter your bedroom while you're sleeping, and you can ask your you said your son or stepson to vacuum more often, especially in those areas like living room where you usually stays for a longer period of time. Okay. Oh.
So
thank God.
Yeah, I'm just going to touch this stuff, and I'm just going to help you.
Yeah, give me an excuse to ask him to clean, right?
Yeah.
Yeah.
Okay. If you wanted, I can just help you out here. Just hold on my elbow so I can help you out to get it out. And do you want to? I can wrap and put all the units in the box, so you can come and take it. Okay.
That's good. Yeah. We'll go.